Welcome to Adapting NCLEX. GI medication are guaranteed to show up on the NCLEX. After watching this video, you will know what to do. Let's make them easy. Most tested GI medications using NCLEX review questions, pharmacology practice test number 5. I'm going to give you mnemonic, easy way to remember them. This is a video you would like to watch a day before you go and take the NCLEX. Let's get to it. These are the medications we'll be covering. As you can see, different classification. And I'm going to give you key mnemonics, high yield questions, and you will love to know how to solve these questions. First question, it's not that difficult. It's based on concept. Which side effects should the nurse monitor for? A nurse is caring for a client receiving Ondansetron IV for nausea. What do you think? Shorten QT intervals, Torsades de Pontes, respiratory depression, hypertension. If you go for the words in the question and the answers, you'll get it wrong. But go for the buzzword. The buzzword is what? Ondansetron. Ondansetron is antiemetic. It's one of those medications that have specific side effect. What is that specific side effect? Look at the answer choice. It's a shorten QT, Torsades de Pontes, respiratory depression, hypertension. This is not one of those questions you see respiratory depression and you pick it. It has nothing to do with that. It has something to do with QT prolongation, right? It doesn't shorten QT. If he's shorting QT, that's not that medication. So that number 1 is wrong. Test taking strategy 1 and 2 saying the same thing, but you don't see it. If you look at it carefully, Torsades de Pontes are caused by QT prolongation, no QT shortening. Therefore, 1, which is a QT shortening, is a wrong answer. QT prolongation is number 2, which can lead to Torsades de Pontes. That is the biggest side effect of Ondansetron. And this is the mnemonic to remember that. Ondansetron is a Zofran. That's the trade name that we are. It's a Zoflat QT, right? Zofran, quick onset, flattening Q8, report palpitation. You're giving us IV slowly and nausea medication. This is the mnemonic you would like to know. You can take a picture, but this is your friend for any question on Ondansetron. Number 2, which action should the nurse prioritize? Prioritization 101. A nurse is caring for a client with Crohn's disease, prescribed what? Adalimumab. This is one of those medications we can use for Crohn's disease for anti-inflammatory effect. It's an immunomodulator. Based on that concept, immunomodulator, use that buzzword. Go for the buzzword. Immunomodulators, what do you think? Should I check CBC? Should I place Mantoux test? Should I check urine culture or should I check blood culture? The concept, immunosuppression. You don't want the individual to get sick. I put a bunch of answers there to trap you. CBC, urine culture, blood culture is talking about infection, but that's not the purpose of these medications. We want to prevent the infection before it comes. Therefore, I got to check your PPD because if you already have PPD positivity, it's going to reactivate you. So placement of Mantoux test is the right answer. 1, 3, and 4 are saying the same thing. And this is the mnemonic. Avoid disease activation in Adalimumab, which would assess for TB, decrease immunosuppression symptoms like risk of infection, and avoid live vaccine. Every time you see this medication, think about avoid disease activation. Number 3, which medication should require clarification if prescribed with Sucralfate? Go for the buzzword. The buzzword is Sucralfate. Focus on that. And nurse is reviewing medication interaction. That means something that can interact with what? Sucralfate, Omeprazole, acetaminophen, Antacids, loperamide. This is a concept that is always taught. Sucralfate is a cement. It's going to coat the inner surface of the stomach. We don't want anything to disrupt the coating of the inner surface of the stomach. Antacid is going to be a problem. You should avoid antacid within 30 minutes of taking Sucralfate. So that is your right answer choice. Omeprazole, acetaminophen, and loperamide does not affect Sucralfate effect. Therefore, what is the mnemonic? Sucralfate stick up late, right? It's sun sensitivity. It causes your urine to change. It can affect your blood level. folate level will be affected and assessed for what? Skin rash. It stick things up. What is the problem with antacid? We call them the scams, right? They separate from what? Other medication because of the explanation I give you. 1 to 2 hours, at least 30 minutes before you can take any medication. Antacids are bad. It causes constipation. Which one? Calcium and aluminum. You should avoid in kidney patients who have buildup of magnesium. So magnesium product for antacid you should avoid. It can lead to magnesium diarrhea related. It's safe for occasional use only, so no more than 2 weeks. So they are called SCAM. These are your mnemonics for what? GI medications. Which client statement indicate correct understanding of the medication? That means they understand. That's all. I've summarized it in my own way. Understand. Which medication? Omeprazole. What? How do you understand it? Okay, is a PPI, right? Therefore, because he has last name of what? Zol. I will take this on an empty stomach before breakfast. Think about it. It's taking it before you eat so that you can block the acid. I will chew the tablet if I can't swallow it whole. This medication comes as a capsule. Do you think you should swallow and crush it? I can stop taking it once I feel better. Well, you can't stop taking medication on your own. It helped decrease my stomach pH. This is the trap. It helped decrease your stomach what? Acid, not the pH. When the acid go down, right? What do you think your pH will happen? When acidity go down, the pH goes up. So if there's no acid, pH should go up, not decrease your pH. So no, answer 4 is not the right answer. The best thing is to take it on an empty stomach before breakfast. Watch for answer choice 4 so that you don't get trapped. What are the prozole? They end with the what? The zol, right? It top the antacid, right? These are one of them. Omeprazole, Pantoprazole. And what is the acronym for that? The mnemonic. Protect stomach lining. There's a risk of fracture. It can lead to osteoporosis if you take it for a long time. It can also have causes C. diff. Those are the things you shouldn't forget. C. diff, fracture, and then B12 deficiency. So watch for those things, decrease calcium, and then osteoporosis. Which client statement require follow-up? And let's provide digital teaching for a client prescribed what? Misoprostol. This is not a medication that you take often. It's ibotogenic, but we give it to patients to prevent NSAID-induced ulcers. That means NSAID. If you take NSAID and you're going to develop ulcers, we'll give you Misoprostol to protect the inner lining of your stomach. We use it for people who have what? Osteoarthritis that can take NSAID for a long time. It can lead to what? Ulcers. So these medications are used for that. Therefore, which one? I will use as contraception while on this medication. This will help prevent stomach ulcers. I take this medication to help with my arthritis. I might have some cramping or diarrhea. Think about it. It's a misoprostol. It's stimulant also. It can activate your GI tract so you can have cramping and diarrhea, right? It can prevent ulcers. Like I tell you, NSAID-induced ulcers are prevented by misoprostol. Because it's ibotogenic, you should take what? Birth control so that you don't get pregnant. You don't take it to prevent your what? Arthritis. It prevents NSAID-induced ulcers. Therefore, the patient does not understand that. The client is prescribed Metoclopramide. Which assessment finding will require immediate action? This is antiemetic. One of the biggest side effects is what we're going to talk about. It increases what? Appetite, involuntary muscle twitching. It causes fatigue and dry mouth. One of the common side effects is diarrhea. One of the worst side effects, it acts like antipsychotic. Do you see antipsychotic answer choice there? Put down your answer. I want you to jot it down and let me know what you think. You can see that number 2, involuntary twitching is tardive dyskinesia. So those are the side effects associated with metoclopramide. How many answers have you get so far? I hope you have 6 out of 6. But if not, this is for you. Watch it multiple times, take notes, and pay attention to this medication because they will show up on your NCLEX. And this is teaching about what? Lactulose for hepatic encephalopathy. This is one of the medication that you see it in nursing school or NCLEX, which client statement indicate correct understanding. That means indication, understanding of lactulose. What are they saying? It helps lower my ammonia level. I should stop taking it if I have diarrhea. This may make me feel more confused at first. I will monitor for constipation. I should take this medication only once a week. 2 to 3 loose stool means the drug is working. What do you think? Hepatic encephalopathy means you're confused from what? Buildup of ammonia. Lactulose will help you get rid of the ammonia by having diarrhea. Therefore, 2 to 3 loose stool is how you titrate it to make sure you're clearing your ammonia. Anything greater than 2 to 3 loose stool is a problem. The idea is 2 to 3 loose stool. So 6 is good. I should take this medication only once a week. No, it's not given once a week. It's titrated to normal stool. I will monitor for constipation. No, it causes diarrhea. This may make me feel more confused at first. It doesn't cause confusion. It helps your confusion to go away. I should stop taking it if I have diarrhea. No, you should not stop taking it, right? I should stop taking it if I have diarrhea. The medication work by giving you diarrhea, but if you have excessive diarrhea, yeah, then you can stop it. It will lower my ammonia level. That's what it does. Selected apply. Those you know you're confident. If you know only one, pick it. There's only 2 answer choice there. If you pick more than that, you lose points. 1 and 6 are the right answer. And this is caring for a client prescribed what? Docosate sodium. This is a stool softener. How does it work? It softens the stool and prevents you from straining. Therefore, based on that, which scenario in this medication is most appropriate? A client with diarrhea after antibiotic use. You have C. diff and you're having diarrhea that's infectious. We don't give you stool softener to do that. A client who should avoid straining during bowel movement. Sound like the right patient, right? A client with hepatic encephalopathy, we give you what? Lactulose, no Docosate. A client with what? Suspected bowel obstruction, we don't give you stool softener. We got to relieve the obstruction. So which one is the most appropriate? Is number 2. Once again, stop the video, answer the question, see the way I approach it. If you get it wrong, put it down in the comments and let me know. We are on number 9. How many have you got so far? And next, review a prescription for loperamide. Do you remember this? I know you know it. What do you think? This is what? Diarrhea medication. It makes you constipated, which client condition is contraindicated. You see, I take the buzzword and I use it to answer the question by saying diarrhea is going to cause constipation. Therefore, if you're already constipated, I'm not going to give it to you. Is that right? That's the way. Or certain conditions should not get it. A client with traveling diarrhea, you having diarrhea, I can make you constipated by giving you loperamide. A client with fever and bloody stool, you have infection. You don't need to be what? Constipated, because the infection needs to get out of your system. A client with mild irritable bowel syndrome, yeah, if you have a lot of diarrhea, we can give you loperamide to slow you down. A client with what? Post-operative loose stool, we can give you something to slow you down. Therefore, bloody diarrhea and fever is contraindicated in the patient with what? Loperamide. The client prescribed pancreolipase. We use it for pancreatic insufficiency. Therefore, if you eat anything that need the pancreas to be digested, like fat, we need to take it with the medication. That's all. This is the way you approach question. Read the question, know the concept you're going to bring with you, and then look at the answer choice. Which instruction should the nurse include? Take this before meal and snack. Oh, if I'm eating and there's fat and other thing, should I take it? You be the judge. Crush the capsule for easier swallowing. Capsules are not supposed to what? Crushed. Take this medication at bedtime. It's taken with food. Limit protein while on this medication. That's not what it does. Therefore, which medication, which instruction is the best one is what? Take it before meals and snack. And next is review medication order for several clients prescribed what? Dicyclomine. What is the function of this medication? This is pharmacology review, pharmacology test number 5, NCLEX review questions, NCLEX questions and answers. And we're using it to do our what? Pharmacology test. So whenever I read the medication, I give you what it is. Pharmacology for dicyclomine is what? Anticholinergic. It slows things down. Which client should the nurse question this prescription? Which patient situation should not be associated with what? Anticholinergic. If you have diarrhea, I can slow you down. If you have dry mouth, occasionally, I can make your dry mouth worsen a little bit. If you have angioglycoma, I can make your glaucoma worsen forever. If you have irritable bowel syndrome, I can make you have constipation a little bit. All of them may have some idea of trouble, but whose trouble, whose situation? If you have 1 second, if you're taking care of this patient, if you see this question and the NCLEX, what answer choice will you pick? I know you're going to choose the right one because you got to be sharp. And what does be sharp means? Breathing issue, electrolyte, shock, sepsis, airway, and then pain. Pain that is going to affect what? Your life, limb, eyesight. I see eyesight there, which is what? Glaucoma. And therefore, number 3 is your right answer. A client with GERD is prescribed what? H2 blockers. They do different things. They bind H2 receptors. They are the tidines that are associated with what? Antacids or acid secretion of GERD. Therefore, which statement indicate a need for further teaching? They're not saying some things that is right with the medication. I will take the medication with meal. That's what they're saying. Do you think it's okay? I can smoke less now since my reflux is associated. Should you smoke while you have GERD and taking medication? This helps reduce my stomach acid. Does that H2 blockers reduce your stomach acid? I should avoid alcohol with this medication. Of course, no alcohol. It reduces acid. You should not smoke, and you take it with meal or 30 minutes before meal. 2, need further teaching. And what is the key associated with them? H2 blockers. This is the key. You take at bedtime, interact with other medication, don't take it with any antacid, increase the pneumonia formation, and then what? It causes what? NSAID in some patients. And next is review medication for a client with a new colostomy. Which order should the nurse clarify? Think about it. Which order should the nurse clarify? What does the patient have? A new colostomy. A new colostomy, you don't want them to be constipated. Which medication is going to cause constipation? Simethicone, take care of your gas. Sodium doxate, help you not to strain, help you stool passes easily. Psyllium is a bulking agent. If you don't know the number 3, diphenocylate atropine, which is like what? Lumonol, is like loperamide. They all causes constipation. Therefore, this patient should avoid number 3. And this is reviewing medication for a client newly diagnosed with what? GERD. The provider prescribed what? PPI. What is the primary purpose of that? This is the good question. I said, I just want to test your mind. PPI, what is the purpose? I'll show you how to answer some questions if you don't have no idea. Look at the answer choice. Neutralizes acid in the esophagus. Blocking acid-producing pump in the stomach. Increasing gastric emptying. Forming a protective barrier over stomach lining. When you finish reading, you say, oh, this is describing, this is a descriptive answer choices. And the question say, prescribe what? PPI, proton pump inhibitor. If I'm picking an answer choice, I'm going for something that has proton, it has pump, and it has inhibitor. I see neutralize in number 1. I get rid of it. I see block, I see pump. Hey, acid, you may be my answer choice. 3 said increasing. There's no proton, no pump, no inhibitor. And then there's formation of protective barrier. It doesn't say proton pump inhibitor. Therefore, 2 is the right answer. And this is some of the mnemonic associated with the PPI, which we saw already. In the last 2 questions, a nurse has received the morning report. Which medication should the nurse administer first? An antacid for a client with indigestion, a PPI for a client with the history of peptic ulcer disease, ranitidine for a client with GERD, and a proton pump inhibitor for a client scheduled for surgery. The key word is what? All of them need their medication, but the most important is pre-op medication. Take precedence over everything. So give it to the patient who is going to surgery to prevent aspiration. And this is providing district teaching to a client prescribed what? Sulfasalazine for what? Ulcerative colitis. Which statement by the client indicate a need for further teaching? These are sulfur drugs. These causes stones. Therefore, you need to drink a lot of water. You got to watch for photosensitivity. It can affect your blood level. It can cause agranulocytosis, pancytopenia. Those are concepts I want you to know and use it to answer the question. I will drink plenty of water, fluid while on this medication. I might have orange color urine. I will stop taking it if I get headache and nausea. I need regular lab tests while on this drug. The blood level need to be checked. You don't need to stop it if you have headache or nausea. Common side effect, your urine is going to change color, and you got to drink a lot of fluids. VI pharmacology, using pharmacology practice tests, pharmacology questions and answers to help you master this content. Thank you. If you like this video, put a comment there and let me know how you think. Thank you very much. Bye.